Let me say, was it last year? Yes, it was last year. I have a nurse. She's working here in this regional hospital. So she came to me and she was really stressed up. She said, sister, the way I'm feeling, I'm not satisfied. I'm having severe low abdominal pain and I'm having irregular messes. I don't sleep at night. And she also tell me that even when I have sexual contact, I'll have pain. I said, okay. I said, no problem. And she further went on explaining that even her mother died of cervical cancer. And she told me, that's why I'm worried. Please, sister, come and screen me, please. I said, you don't need to beg me. I said, you don't need to beg me. That's my job. And she was willing. I said, okay. I explained to her. I counseled her. And we went to do the screening. And when I did the screening, the results, she was VIA positive. She has pre-cancer lesions. And she was so happy. Said, yes, sister, I'm happy today that I've been diagnosed, because I know I'm an high-risk person, because my mother was diagnosed with cervical cancer and she died of that disease. And today I'm opportune and you've diagnosed me that I have pre-cancer lesions. Then I counseled her again about the treatment. And she asked, sister, just go ahead and treat me. I'm ready. I'm really ready. I'm more than ready. I said, wow, okay, let's do the treatment. And we did the treatment. And after the treatment, in 6 weeks' time, she came back for review. And the cervix was really okay.
Cervical cancer is among the gynecological cancers among women of reproductive age. And I think it's globally, the third leading cause of gynecological cancer after endometrial cancer, ovarian cancer. But here in low-income countries, middle-income countries like Africa, Sierra Leone, I think cervical cancer is the second leading cause of cancers of reproductive age women after breast cancers.
So if you have cervical cancer, and of course we know it's an abnormal cells growing also, we know what has happened, and the cervix is one of the decide for any pregnancy, introduction of sperm to the genital area or the womb for fertilizations. So if you start getting problem also with all this offensive also, there's possibility it can spread to your womb in a way that you cannot able to get pregnant.
Okay, so it becomes very challenging to offer care with cancer in pregnancy. So certain things like you cannot operate because if you operate on the cervix, it means the pregnancy will abort, no? So you have to wait until maybe she delivers, then you can intervene in care, okay?
So those are some of the key things why we want to prevent it at the earlier stage, because if you are treated, there is possibility, yes, you will get, pregnant again.
Cervical cancer, one opportunity I would say that is very big for them, it's a disease that is preventable. So if only you have a disease that is preventable and it is treatable, so why do people suffer from cervical cancer when they have the opportunity to be screened and treated free without paying any money? So I usually encourage them, because that's a big opportunity for you to have a disease that can be prevented through vaccination and also through screening and even your lifestyle. So it's very important. Cervical cancer, most oftenly, it doesn't present with signs and symptoms. It's only present with signs and symptoms during the late stages. So when you are screened, it gives you the opportunity for you to be prevented from cervical cancer. The process that I usually do when clients come, when they come for screening, I gather them together and I speak to them. I counsel them about cervical cancer. I give them the knowledge and the awareness of cervical cancer. When they are tested VIA positive, they are treated with thermal ablation and also cryotherapy. These are the two treatments that are available here at our hospital.
And then now they will come back to normal. But they need to know that after every 3 years, again, they need to go again and treat themselves, because this is not telling them that, okay, you are being prevented forever. Like, even taking vaccine also, you need to take some booster after some years or so. So we usually tell them to go again for screening after 3 years or so. You are due, go again and do your testing also.
Like how depot they ask no more, but presently we not get depot no the rights now.
Okay.
So this thing already like where clients come, then we explain to them.
Okay,
yes, because this and this the workers the same.
Okay.
This like how this in the survey they have 3 months this back and 2 back.
It's one of the conditions that I see being neglected, and it's a condition that contribute to a high percentage of women's death within even globally, but Africa and Sierra Leone, and that happen which we are unknown.
As a family medicine physician, we focus on prevention, and I know I've said that word 1,000 times, but I mean that's step one in health, is making sure that we don't contract things that are preventable. And HPV is a virus that has been found to cause cervical cancer. And it is a type of cancer that is preventable. So if we educate the midwives, advanced practitioners, nurses on how to screen for it, then we can catch it either at its early stages, or we can help people actually not contract the virus in the first place.
We all know how the health system is within our environment or communities, wherein it's a little bit challenge in terms of people doing routine screening for some of those conditions. And okay, they may want to, but also the availability of those facilities to do the routine screening. But there is no much facilities within the country like accessible at all time, at all level for this, and it's something that is really key, and it's a condition that really need to be paid attention to, because there's a lot of damage or complication that is costing presently to women.
what I need in me to prevent cervical cancer, one first of all is vaccination, preventive, primary prevention. Also, before disease comes in, you prevent the disease from occurring. So the two tools for me, I believe, which works, so that we can achieve the 7 different goals of eliminating cervical cancer, is uptake of vaccine, the HPV vaccine, either via Cervarix, Gardasil. So that is one. We can reach them through schools, the teenage groups, schools, outreaches, mobile clinics, so that, and then health education. People should have the knowledge. How is it spread? How do you acquire cervical cancer? These are things we need to intervene and do.
Yes, a lot. A lot of stigma, especially when women are not able to have children. And they don't know why they are not able to have children. And usually it even causes family fluid. Yeah, because they can say, why are you not having children? They can attribute that to witchcraft. They can attribute that to a demon. They can attribute that to other things that has nothing to do with your health.
And one key thing we need to understand also is something that people get through sexual exposure also, and even at earlier stage also, by getting the human papilloma virus also. So you can get it through your man, maybe even the woman was not the one that had it, it's through the husband that he got it through. But now you may not tell, and they may not accept that. They will just put the blame all on the woman, that okay, it's because of you. And so even when they are treated, we also want some of these to be spread to the men, so that they will understand that this is the problem and this is what is happening. And even when they are on treatment also, sometimes they tend to advise them to stay away from sex for sometimes also. And so the men don't feel comfortable of that, so they may feel that women want to do other things, that's why they are not allowing them to have sex with them. But they need to understand, so that's why you need to bring them on board to tell them when you are testing them and treating them.
Challenges is these outreaches. Yes, because most people, they are not aware. When they come to the facility, they say that I've never heard about cervical cancer. Maybe it's the signs and symptoms. By the time they came, it is late. So I think if only we have support in that area, like going to the radio, reaching the communities, going to the market, churches. There are times I have opportunity to go to churches. Sometimes when I go to the market, I even talk about cervical cancer for them to be aware about cervical cancer, I think.
I'm Milton Franklin Kuruma, and I'm the district community mobilizer for the All Hope International Cervical Cancer Screening Department. Well, to start with, initially when we started, cervical cancer was not as popular as it is now. And most of the communities we've been working at, they never heard about cervical cancer. Initially, in fact, they were thinking like, is this a new disease? Is this a new thing? We never heard about this. Where are you guys coming with? Where are you coming from with this type of messages? So the cervical cancer as a whole was politicized due to like lack of information. People were saying it is a plot the government brought in this cervical cancer screening as a means of reducing the birth rate among women. So for us to persuade them in their mindset from being a birth rate kind of control to a positive thing for the women, for me that one was the biggest challenge as a mobilizer. As long as it has to do with health and it has to do with the female reproductive organ, again, it all depends on the messaging. As a community mobilizer, like, you need to know when and how to pass on a particular message that will trigger the women to come out. There are some sensitive messages you don't give out to the open. You know, the communities are so dynamic in a way that what is applicable in this community might not be applicable in the next community. So, like, we as a team, we were able to identify these dynamics among the community, the different type of communities. Then they started coming willingly.
Cervical cancer, to me, I see is gender inequality. Women should not suffer from certain diseases. They should have a high burden of certain sickness, which men are not having. Because if you see the World Health definition, what is health? Absence of physical, mental, social imbalance, okay? So we need to ensure that these people have good quality life when we address their health issues. Is that not a human rights issue? It's a human rights issue.